Majority Whip.
President, I ask unanimous consent to waive the mandatory quorum clause with respect to calendar number 285, S3386, and calendar 284 and S3385.
Without objection.
Mr. President, $83 billion. That's how much Democrats want to send and will vote today to send to bail out a failed Obamacare health care system. Look, I'm a doctor, as are you, Mr. President. We want patients to get the care they need from a doctor they choose at lower costs. Obamacare robbed the American people of choice as well as affordability. So the Democrats are back here today saying they want to send an additional $83 billion directly from the Treasury of the United States to the pockets of the health insurance companies of America. Mr. President, Obamacare has failed so badly that Democrats continue to use taxpayer dollars to try to hide the failures. That's what this whole Biden COVID bonus scam is all about. These are juicy subsidies, extra subsidies, on top of the regular Obamacare subsidies, and they're the ones that are expiring at the end of this month. You may recall, Mr. President, that in 2021, the Biden COVID bonuses were rushed through by Democrats, and they called them temporary, emergency measures because of COVID. They created these Biden COVID bonus payments without a single Republican vote. So why'd they create them? It's because Obamacare is unaffordable. People all across the country understand that. Democrats have known it from the beginning. They just refuse to admit it. In 2022, they extended the Biden COVID bonuses, again without a single Republican vote. Now, the tax and spend radicals who run the Democrat Party want to extend them again, these bonuses payments, for an additional 3 years. Oh, and they want to do it with zero reforms. This is a program that is chock full of waste, fraud, abuse, and corruption. And they do nothing to help try to make health care affordable for the families of America. So the choice today is simple. We want to send more taxpayer dollars as welfare to insurance companies, or do we want to make health care more affordable for patients and put patients in control? So let's start with the Democrat bill. The Democrat bill forces Americans to pay $6,000 out of pocket before insurance even kicks in. That's called the deductible. It continues the same failed Obamacare policies that raised premiums for American families by over 220% since Obamacare became law. No reforms. Well, remember, wasn't it President Obama, Mr. President, who said to the nation, oh, if you pass my plan, premiums will go down by $2,500 per year per family? They didn't. They doubled. I think they called that one the lie of the year by the Obamacare. Democrats refuse to include any of the needed reforms to deal with the significant flaws and fraud of Obamacare. This month, the government investigators, the GAO, the Government Accountability Office, they uncovered $21 billion being sent in 1 year alone, in 2023, $21 billion sent to insurance companies with policies where there was no verification of the patient's, of that person's income, no verification of their citizenship, no verification, in many cases, of the person's actual existence. Hard to believe, but true. Opinion pieces have been written, even by the Washington Post, that talked about the level of fraud. There are 20 million people on Obamacare right now. You talk about $21 billion for the 20 million divided out. It's about $1,000 worth of potential fraud for each and every enrollee in Obamacare. And what do Democrats want? They want to continue this unchecked for the next 3 years. No changes, no reforms, nothing. Worst of all, Democrats want to send tens of billions of dollars every year directly from the government directly into the bank accounts of the insurance companies. How have insurance companies felt about this? Hey, they're licking their lips for $83 billion more because insurance companies, their stock prices have gone up between 500 and 1,000% since Obamacare became law. Seems like Democrats are interested in making them even richer. What they're proposing isn't a serious plan. It is a disaster. Our nation can't afford it. And the American people can't afford to pay these high costs for health care, and we need to focus on the cost of care and how we as doctors can lower that cost of care for American families. So we have a better approach. It's a simple approach. We start with a simple principle, and that principle is health care should work for patients, not for big insurance companies. Our plan sends money that is now going to insurance companies, send it directly into the pocketbooks and the pockets of the hardworking families of America. That's where the money belongs. It does that by expanding health savings accounts, not direct payments to insurance companies for more Obamacare. Our plan reduces the payments to insurance companies by $30 billion, and it will lower health care premiums by 11%. Our plan puts patients in charge. They'd be in the driver's seat. That's who needs to be in the driver's seat. Real freedom to get the health care that works best for them and their families. Our plan restricts federal Medicaid funding to states that give health insurance to illegal immigrants. People say, oh, you can't be giving it to illegal immigrants. It's illegal to give it to illegal immigrants. Doesn't mean states aren't doing it. And the GAO study found that the Obamacare plans are also and have been used by illegal immigrants. It requires states to verify citizenship prior to signing someone up for Medicaid as well as for Obamacare. And our plan upholds Hyde Amendment protections, protecting Americans' rights of conscience. Our plan is fully paid for. It's an end to the Democrat era of runaway spending to cover up Obamacare's high prices. I'm a doctor, practiced medicine for 24 years in Wyoming, and I can tell you this, Mr. President. When patients have more freedom and more choices, health care improves. When patients have more freedom and more choices, costs go down. That's what Republicans are voting for today. And I really want to thank Senator Mike Crapo of Idaho, Senator Bill Cassidy of Louisiana for leading this effort. I want to thank you, Mr. President, for your efforts to find reforms that will actually work, that will help patients, will help lower the cost, put them in charge. That's what we really need to do, lower health care costs for hardworking families. So the contrast is clear. Today, Democrats are going to vote to protect a broken system of higher costs, of rampant fraud, and big checks to insurance companies. Republicans are going to vote for a plan that lowers health care prices and empowers patients. It empowers them to choose the doctor and the care that works best for them. That's what Republicans are committed to. We're committed to delivering what the American people deserve, which is that the care that they need from a doctor they choose at a cost they can afford. Thank you, Mr. President. I yield the floor. Suggest the absence of a quorum.
The clerk will call the roll.
Ms. Alsop-Brooks.